Hi, Flavio. Thank you. Thank you for this invitation. I'm here with Elitania, and we're together to present how we work with the extended value stream in cancer care, the Previna project, since 2018, that we've been working together with the complete team from the City Healthcare Authority. So I will share my screen now, and Elitania, we will divide the presentation. So part of the time it will be me, part of the time it will be her. Are you seeing my screen now? Okay, so well, this is the Previna project, and this is the working team. We have a big team working together. There's a lot of more people working in there, but this is the core team. Well, what is the problem we are trying to solve? That's the basic question. And we were trying to solve the problem of cancer access. Patients at IOV and at other healthcare organizations were having trouble to get access to cancer care. Actually, the point for us at IOV is to reduce the cancer burden among us all. And waiting time is a terrible cancer burden. You know that if you wait a lot of time to get access to adequate treatment for cancer, the prognosis go far worse. So the main point for us at that point was to reduce the cancer burden, improving the experience of care, the cost of care, and the population health. So we put forces together, IOV and the City Healthcare Authority, with the Previna project, using PDCA and an A3s to try to improve the flow and the quality of care for cancer patients in São José dos Campos. So thinking about Lean, well, we developed our project thinking about creating a daily management, creating escalated daily management, leadership development and discipline. And Elitania is the leader of this project, and she will present how it is doing so far. Develop problem-solving capability, developing standardized processes. Basically, the standardized process that we were working is huddles, weekly huddles, daily huddles, using visual tools. So it was a shared vision about leadership behavior. We used some cross-pollination about plans and tracks and how to sustain it, about using the experience that we had at IOV and managing and sustaining these projects. We developed a short and long-term goals with 4 major plans involving Previna and other initiatives in the City Healthcare Authority. This is a photo of our Obeya room where several projects were put together. One of them was the Previna, and created a navigation system for the whole system. The background of São José dos Campos is that São José is a big city. We have 700,000 inhabitants. And this project was launched to improve the quality of care. At the same time that we joined the Previna, we joined a lot of other projects with the City Healthcare Authority. But the rationale for the Previna project is that cancer is the second leading cause of death in the city, and cancer patients were facing real long waiting time for access appropriate care, besides the high budget assigned to cancer care. Well, some specialties had waiting time to access longer than a year. Some patients, like urology, had no dedicated access for cancer patients. So we had no care path for those patients. The main idea was develop flow, daily management, and dedicated access for those patients. Well, the project with the City Healthcare Authority involved not only cancer care, but this is the timeline for the cancer care. In 2018-19, we redesigned the chemo access and chemo care center in the hospital that is responsible for chemo and surgery care for those patients. In 2019, up to now, we started and developed together the Previna daily management. then the prostate cancer flow redesign that Elitania will present. We redesigned the flow of radiation oncology completely to get access to prostate cancer patients. And the big challenge now is to sustain during pandemic. So it's a real challenge that keep patients up to cancer care in this terrible condition of the pandemic that affecting us all. This is the public cancer center flow redesign, the hospital named Pew 12. We see more than 2,000 new patients a year. And we created a very simple project. Queue management, separating patients in fast track, regular track, and special track for 4 product families: chemo, fast track, and chemo regular track, oral patients that follow the regular track, and follow up for those patients that were the special track, those patients that had no urgency of care at all. With all these new flows, 6 months of training, and we increased only 10% of the personnel, including 1 pharmacist and 1 extra nurse. During the transition process, the hospital moved from 430 patients under treatment per month to more than 900 patients under treatment per month. So that's the hugest transition and one of the most impactant activities that we did to create room for those new patients that we had no access at that point, and you will see later. The same thing happened in the radiation oncology, that we had to redesign the flow using the same idea behind the chemo patients, creating fast track, regular track for planned care. At that point, we created a fast track for prostate cancer, because the prostate cancer was our pilot work with the Previna, and we had to open room for those patients. So we created a lot of urgent access, those red dots on the top right of this slide. And we created 4 product families as well. So prostate, fast, and regular track. The other product family was breast cancer, because prostate and breast cancer represented like 70% of our patients, and we decided that those patients should have special flows. The other patients, 30% of the total, and emergencies had their own flows, and we had room for those patients under emergencies as well. Well, at this point, I will introduce Elitania again, and she will tell us how prostate cancer flow redesign and how the whole Previna project ended up at that point. Elitania?
Hello. First, I am very pleased to be here to present our work using lean tools, aiming to improve the treatment of cancer patients in our city. And the first pilot project was for prostate cancer. We redesigned this flow, and based on the rationale that patients aged between 50 and 79 years old with PSA over than 10 have 67% chance of being carrying a prostate cancer based on the literature data. Patients with elevated PSA had no special flow to access urologist and to get a prostate biopsy. That waiting time to access a urologist was over than 180 days, and 100% of patients with PSA over than 10 should be biopsied if not contraindicated for other medical issues. Thus, the redesign was that patients considered high risk were assessed by a clinician and a biopsy was indicated. The patients considered low risk, this with PSA between 4 and 10, were evaluated by a neurologist in a special track. And from April 2019 to September 2020, 277 patients were biopsied in the fast track. For these patients, we had that 54% were positive for cancer, not as predicted by other studies, and 72% had aggressive prostate cancer. Okay, the other one. Okay. Since we start our project, we could see that the treatment up to 60 days, we improve more than 50% between 20 and 16 for 2020. And this was a very good result. And the other one, okay. The Previna project is grounded in 4 major actions. The first one is the process redesign. First, to better connect several different providers in several different organizations under an oncology supervision, my supervision. Daily problem solving for teams involved. Active surveillance for high-risk tests like PSA, mammogram, biopsies, colonoscopes, and PAP smears. And manage daily flow and prioritization using visual tools. Okay. The second one for these major actions is escalated daily management system. So we have daily catchball with primary, secondary, and tertiary care providers, weekly catchball with oncology care providers, and biweekly huddle for global performance with City Healthcare Authority for All. The third is open communication channels, a hotline with the flow manager for 46 primary and other secondary care units, specialized decision support by phone with an oncologist, and strategy deployment. And 4, emergency access and flow, standarded emergency access routines. The Previna results since 2018 to 2020 is that cancer diagnosis increased substantially, even during pandemic period. Access to care before 60 days of diagnosis almost doubled from 2017 to 2020. Flow improvement reduced time to access breast cancer immunohistochemistry from 38 days in 2018 to 4 days in 2020. And hotline answered more than 2,500 demands up to December 2020, coming from primary and secondary care providers to improve patient access and flow. The Previna results between since 2018 to 2020. In this slide, we can show that the treatment start up to 60 days, improve more than 50% from 2016 to 2020. Previna 2020. During the COVID-19 pandemic, we had our hospital, oncology hospital called PIL-12, was designated a COVID-free hospital. Since this, no COVID patient admission, elective surgery suspended only for 3 weeks during the initial phase of pandemic, Hispanic days, and we transfer COVID positive patients to other facilities. We had significant decrease in secondary care procedures, biopsies, CAT scans, and other procedures, and QE management to provide access to high-risk patients. We had in Brazil during pandemic a 77% reduction in cancer diagnosis. But in our city, with these tools, we had only 20% reduction in cancer diagnosis with the period of pandemic of COVID-19. Our challenges for the future are that COVID-19 pandemic reduced volume and access to care during quarantines and limited resources. Sustained improvement is dependent on leadership and teams' commitment to keep all elements combination active. The leadership, development, and discipline are crucial for a project like Previna. And a cultural shift usually requires more than 5 years of stable process. Thank you. E aí? Não estou te ouvindo.
It's a great work. So we'll have like 5 minutes to Q&A and we'll be going back live. Thank you, Elitânia. Bye.
Thank you.